What if I told you that there was an epidemic going on right now affecting over 50% of the population? What's worse, what if I told you that it's rarely diagnosed, has been linked to cancer, high blood pressure, heart disease, fibromyalgia, diabetes, depression, chronic muscular pain, bone loss, hair loss, and autoimmune diseases like Hashimoto's and multiple sclerosis? I bet you think it would be the talk of every 6 o'clock news program and that everyone would be going to their doctor to get diagnosed and treated. I bet you would want to know what this horrible epidemic was. Dr. Binley here. I'm going to tell you what this real epidemic is and how you can protect yourself from it. If this is your first time on my channel, well, welcome. I regularly post nutritional health information that you're not going to get in mainstream media. And so be sure to subscribe so that you don't miss any of it. Also, remember to hit the little bell down below so that you get notified when one of my new video posts. So what is this epidemic? Well, it is a deficiency of a vital nutrient. And I also tell you that our daily needs of it to be healthy, not just sick from its deficiency, are actually up to 25 times the amount our government tells us what we need. It's somewhat hard to source from our food supply, but your body is actually able to manufacture for free almost all you need if given the chance. I'm going to tell you how to know if you're deficient in it, how to best increase your levels, what foods you can eat to get it, what drugs might be causing your deficiency, and how much to take to correct all of this. So what is this vitamin nutrient? Well, it's vitamin D. For over the past 30 plus years of my practice, my focus has been to discover what the body needs to optimally function, and I've always been focused on the specific role of nutrients. Vitamin D is no exception, especially as I have found that this vitamin is deficient in the great majority of patients with chronic illnesses. Vitamin D is called the sunshine vitamin, but it's not in the sunshine. Your body actually synthesizes it using the sun, then combining it with cholesterol in our skin. Vitamin D is unique in that your body is able to make it on its own. A side note here, with sunshine being one building block of vitamin D and cholesterol or fat being the other, you can see how important it is to only eat high quality fats. Stay away from processed foods and low quality fats commonly used in packaged foods and of course fast foods. Always strive to eat organic meats and fats. Let's take a look at the massive impact that vitamin D has on health and the function of every cell and gene in your body. First of all, vitamin D reduces uncontrolled cellular growth as it happens in cancer and guides healthy cells differentiation rather than an unhealthy mutation of the cancer cell. This puts the cells into an anti-cancer state, which makes vitamin D one of the most important inhibitors and explains why vitamin D is deficiency has been linked to colon, prostate, breast, and ovarian cancers. If we make our own vitamin D from the easily available sunshine, you might ask, well, why would we ever end up deficient? And I practice in Southern California on the coast where you would think that everyone gets vitamin D. You may be shocked to hear that the majority of the patients that I see are actually deficient. But why? Well, the first answer is that most people clean their skin with harsh detergent soaps that wipe off the cholesterol that naturally hangs in our skin. Without that abundant cholesterol in the skin, there will be no synthesis of vitamin D from the sunshine because a building block is missing. Now, secondly, Most people only experience the sun after they rub or spray on sunscreen. Anything over SPF 8 blocks the UV light from activating your cholesterol to form vitamin D, causing a 97% reduction of your body's vitamin D production. The general rule of thumb is that the lower your sun exposure, the lower your vitamin D synthesis or production. So also, the natural color of your skin affects this as well. People with darker skin require more sunlight than those with light-colored skin to synthesize all the vitamin D they need, especially during the winter. Darker skinned individuals are at risk for vitamin D deficiencies. Also, anyone living above the 37th parallel is at risk for vitamin D deficiency during the fall and the winter months. Medications can also affect vitamin D levels. Certain prescription medications can contribute to a deficiency, such as cholesterol-lowering medications, diuretics, proton pump inhibitors, anti-inflammatory steroids, anti-seizure medications, and antiviral medications. Certain diseases can also contribute to vitamin D deficiency, such as malabsorption syndromes of the colon, like leaky gut, small intestinal bacterial overgrowth, known as SIBO, and other microbial imbalances. Celiac disease, non-gluten sensitivity, ulcerative colitis, Crohn's disease, gallstones, exocrine pancreatic disorders, kidney diseases as well. With all of these causes of vitamin D deficiency, you can see why supplementing with enough vitamin D is vital. But what is enough? Unfortunately, you're not usually being told the right amount of vitamin D to take. The U.S. government, RDA, is 200 to 600 international units daily. But this is outdated information. The amount is only enough to prevent the deficiency disease known as rickets. The real question is, how much vitamin D do we need for optimal health? How much do you need to decrease your odds of getting type 2 diabetes, autoimmune disease, high blood pressure, fibromyalgia, depression, osteoporosis, or even cancer? The answer is that you need to know your levels before you start supplementing. First, find out what your levels are. Then get an excellent protocol designed with the proper pure form of vitamin D and see what it takes to maintain that optimal level. Testing for vitamin D is done through blood testing, but you have to be specific and ask for the 25-OH test. This test determines the serum levels of vitamin D3. In conjunction with this, I also want to test for intracellular levels so I can see how much vitamin D is inside the cell and how well it is regulated and works. I use a very specialized lab for this. You really need to know both levels. Lastly, there is a genetic test known as the VDR test, which is important. This shows your genetic state of the vitamin D receptor that you make. Between these three tests, you can truly get a picture of vitamin D health and the use in your body. Now, you may have heard that you can overdose on vitamin D, and you wonder, can too much of a good thing be bad? Well, the short answer is yes. Vitamin D is a fat-soluble vitamin, which means that excesses are stored in the body rather than being simply urinated or sweated out, as would be the case with a water-soluble vitamin such as vitamin C or the B vitamin family, for example. There are, in fact, a few side effects from too much vitamin D. One of the more common is hypercalcemia, which is too much calcium in the bloodstream. This can lead to kidney disease, kidney stones, if too much calcium gets trapped into the kidneys, which nobody really wants. Other side effects of too much vitamin D are the reduced function of vitamin K or magnesium. In addition, too much could result in digestive distress, causing stomach pain, nausea, and constipation, or vomiting, or frequent urination. So here are my 7 strategies for optimal levels of vitamin D. Number 1, get tested for the 25-OH vitamin D, and the other two tests. The current ranges for normal serum levels were broad, 25 to 137 nanomoles per liter. Remember, normal levels here just means prevention of rickets. These levels are not the ranges for optimal health, which would be 100 to 130 nanomoles per liter. Take the right type of vitamin D. The only active form is vitamin D3, that's called cholecalciferol. Look for this type. Many vitamins and prescriptions have vitamin D as vitamin D2, which is not biologically active. If you had your gallbladder removed, its preferred use is a liposomal delivery source, which also includes vitamin K, and do not get a soy-based product. Number 3, take the right amount of vitamin D. There are many strategies to correct your levels, such as a loading protocol. So it's best to consult with a functional doctor to figure out what is best for you. Number 4, monitor your vitamin D status. Until you are in the optimal range. So if you're taking higher doses, such as 10,000 international units a day, your doctor must also check your calcium and phosphorus and magnesium levels, as well as your parathyroid hormone levels every 3 months. Remember that it takes up to 6 to 10 months to fill up the tank for vitamin D when you are deficient. And then once your levels have normalized for vitamin D, you can lower the dose to the maintenance dose, which is about 2,000 to 4,000 international units a day. And try to eat dietary sources of these vitamins. And these include wild-caught salmon, mackerel, sardines. Eggs have a little bit of vitamin D, but they're not a really strong source. You can see that there is some scarcity in the foods that we have that provide vitamin D for us. Number 6, use gentle washes on your skin to avoid scrubbing away your natural cholesterol. We have a bit of germophobia in our modern society that isn't really serving us. And I'm not saying you have to stink up the place, but find gentle soaps such as Dr. Bronner's or a natural goat soap that aren't as harsh as the others. Number 7, the best way to get your vitamin D is to get outside. Simple sun exposure of 30 minutes per day between 9 a.m. to 11 a.m. in the summer is equivalent to getting 10,000 to 30,000 international units of vitamin D. I tell all the people I can counsel to get outside. There is an app called the D-Miner, that lets you know wherever you are and at what time you can expose yourself to sunlight to maximize the vitamin D synthesis from the sunlight. 3 days a week is recommended. Of course, be smart and know your own limits. The idea is exposure, not burning. Now you can feel why I am so passionate about vitamin D. This vitamin is at the intersection of good and optimal health. Start striving for optimal levels and watch your health improve. I sure hope this was valuable information for you. Be sure to give me a thumbs up if you liked it, especially if you learned something. If you didn't learn something valuable, well, leave me a thumbs down and tell me in the comment how I can do better for you. I'm always striving to deliver valuable content. If you know someone who needs to hear this, please pass it along. Sharing is caring. And I want to reach as many people as I can and heal as many as need me. I have more content on my website where I go even deeper about significant health topics such as nutrients and diets and lifestyle pivots that you can actually make today for your own health. Plus how I practice functional medicine. I'll leave a link below and also to my Facebook and Instagram. I'd love to connect with you there. And lastly, if you are already doing the right things, but you're still struggling with a health challenge, you may benefit from working with me directly. I consult with people all over the map. reach out via the link below and let's see if we are a good match and if I can be of help. Thanks for tuning in. This is Dr. Wade Binley.